My name is Salman Faisal. I'm one of the fellows at Roswell Cancer Center, and I have Dr. Jatwani, Karan Jatwani, with me today. He is a fellow at Roswell Cancer Center, and he is an incoming attending at George Washington University Hospital for Gastrourinary Oncology. And today we are here to discuss his great work that he is doing in prostate cancer and looking at the use of PARP inhibitors. So, Dr. Jatwani, if I ask you about summary of your findings, can you describe that?
Yes, so essentially, as we know that for metastatic castration-resistant prostate cancer, there are currently PARP inhibitors that have been approved, especially for the BRCA1, BRCA2 ATM mutations. We essentially looked into the FDA-approved PARP inhibitors that are olaparib, rucaparib, niraparib, and talazoparib. And we queried the FDA adverse event reporting system database, and we specifically were interested in the myelosuppressive events that PARP inhibitors are known to cause. And we defined the myelosuppressive events as anemia, thrombocytopenia, pancytopenia, and MDS AML. And we queried around 2,137 patients. And we found that olaparib was between olaparib, niraparib, rucaparib, and talazoparib. It was an interesting finding that all the PARP inhibitors cause anemia in the tune of 15%. And also talazoparib was significantly had a significantly higher rate of reporting of MDS AML in the tune of 2% versus olaparib that seems to be around 1.2%. And in terms of pancytopenia, talazoparib seemed to be the one that causes more or has been reported by the FDA as one of the more common ones to cause pancytopenia. And niraparib seems to be one of the medications that causes more thrombocytopenia. One of the limitations of the database is that these data points are reported by either the patient or the physician. So we used a novel algorithmic tool called AERS Mine that has been developed by Dr. Mayur Sarangdar at University of Cincinnati, with whom we collaborated. And we have been able to sort of limit some of those limitations from this publicly available database. In the future, we hope to sort of take it to the manuscript level, but this is the first reported comparative efficacy of safety events across all PARP inhibitors in prostate cancer. So yeah, we are very excited about our work.
Wonderful, wonderful. My question would be when you talk about AML and MDS, because that are very, very important things to consider, and then they have a very specific therapy as well. So, in which patients would you expect them to be? Because in the data we cannot go back in time. But like if you in reality when you see a patient, at what point would you consider that a possibility?
Yeah, I think some of the things to keep in mind that at least in our analysis, we are unable to account for previous chemotherapy, previous radiation therapy, age of the patient, which are all kind of prognostic factors for AML or MDS, especially therapy-related MDS and AML. And this is going to be the hypothesis that we'll be working on in the future. In the clinics, whenever we see a new onset anemia, a new onset decrease in platelet counts, or new onset decrease in across the cell lines, we definitely get alarmed, and we always ask our hematologists to sort of help us out, because early recognition of these adverse events is what is the most critical part that we need to keep in mind. And I think highlighting these adverse events at an early stage would be something that would be helpful for the community oncologists as well, apart from academia.
Perfect. And all these side effects that you saw, are they described in literature for other cancers, especially ovarian cancer, because we have more experience with PARP inhibitors in that space?
Yes, they have been, although talazoparib has a unique indication, if I'm not wrong, only in prostate cancer. So there are a couple of PARP inhibitors that are unique to prostate cancer, and again, prostate cancer patient population is quite different. Again, it's exclusively males, so I don't know if gender is one of the risk factors for PARP inhibitors to cause any of these neoplasms in the future, but that would be something that we would look in the future.
Alrighty, perfect. Thank you so much for your
Thank
work.
you.